All right, welcome back, and welcome to those who are just joining us. It's wonderful to see you. I understand the weather has just started to get worse. Sorry about that. I can't control that. Couple of quick reminders, things to before we get started again. You may have just heard me, but in case you didn't, if you are here for CMTE credit, I do need you to initial back in at the table where you signed your name this morning. Also, if you were not here this morning, you missed a wonderful morning, but Ami has offered to send you a free self-care package, including the grounded meditation recording and script, links to additional self-care resources, and presentation slides from today. You simply have to sign up at the email. No, it's not email, I'm sorry. I guess it is email, right? Sign up there. If you prefer, there's also a sign-up sheet at the table outside of the recital hall. I am going to ask this group of students over here, if you guys can kind of fill in over here, because you're not going to be able to see the slides, and it's actually really hard for the presenter to look that way at you, so can you guys kind of fill in, please? Thank you. All right, just a couple of quick reminders. If you need to use the facilities, the restroom facilities, they are off to your left, my right. There is coffee and water and some fruit in the back. And also know that we are live streaming, so that if you are asking a question, it is absolutely essential that you use a microphone. And we have microphones up here, and I'm happy to bring them to you, but the audience who is on the internet cannot hear your questions if they are not in a microphone, and it makes it kind of awkward. So please remember that you do need to use a microphone. All right, now we can all breathe. I am going to introduce our guest again, because again, I know we have new people. So Ami Kinamara is the founder of the SelfCare Institute. She provides therapeutic support for professionals around the world who are experiencing burnout. She's the author of Resilience Over Burnout, a self-care guide for music therapists, and the creator and the facilitator of Resilience Over Burnout, a self-care program, which is a 31 continuing music therapy education credit online program. Please put your hands together and welcome her back to the stage.
So, this is the sort of lighter part of the day. We spent the morning talking about burnout. Now, this is better? All right. So, this afternoon we'll be talking about self-care. Now, before we talk about self-care, let's practice self-care. So, take a deep breath in. Gently exhale. And this is a self-care practice you always have available is your breath. And so your self-care anchor number 6 for today is I can take a breath anytime I need to. If you're new here, we've been listing down our self-care anchors for the day. You can easily catch up. Our 1 through 5 are up here, and then we'll go through 6 through 10 this afternoon. So I can take a breath anytime I need to. And I just want to let you know, when it comes to burnout, if you have any questions, I will have time at the end of today to address any questions. Also, if you are interested in hearing my entire story about burnout, you can listen to the podcast, the Music Therapy Chronicles. Trisha, are you here? Trisha. So Trisha has an amazing podcast called the Music Therapy Chronicles, and we did an episode together, and I shared my story of burnout. It was like an hour long, so I'm not going to spend an hour here telling you my whole story, but if you're interested, it's there. There's other really great podcast episodes, too. I binge listened to it just in 1 week, so highly recommend that. So when it comes to breathing, it's always available to us, but our breath is something that's sort of easy to just take for granted. And so Slowing down your breath can slow down your heart rate. It can lower your blood pressure. It can just slow down that stress response in your body. It can also slow down the thoughts in your mind, and it can give you just a sense of control over your body. And this is one very effective self-care tool to use at almost any time. So, this afternoon, we'll be talking about some essential self-care practices for music therapists. And before I go over the specific self-care practices, I'd like to define what self-care actually is. And so sometimes this word self-care can be a little bit confusing. Sometimes we think of self-care as like, taking a bath or getting a massage or going to yoga or something like that. And those things are self-care practices, but self-care is much broader than that. Now, this is a definition of self-care I've come up with on my own, and it's the practices we implement to honor our personal and professional roles through action and mindset. Now, some important things here. We have personal and professional. So self-care is not just what you do outside of work. Self-care can happen at work. Self-care and work can coexist, but self-care and work are not separate things, and self-care does support your personal and your professional life. And then we have two words at the bottom here, action and mindset. And so self-care is not just action. It's not just behavior, but it's what we're thinking about, the way we're talking to ourselves in our head. And so self-care can include many types of different behaviors, but it's not just action. It's also what we're thinking about. And so this brings in two different types of dimensions to self-care. And now when it comes to self-care research, here is my very favorite quote that I've read in all of the self-care research, and we'll read this together. Self-care is not an indulgence. It is an essential component of prevention of distress, burnout, and impairment. It should not be considered as something extra or nice to do if you have the time, but is an essential part of our professional identities. So again, it's not something extra. It's not something nice to do if you have the time. This is not things you just do with your free time. But I like to think of self-care as part of your professional role, and it's part of your responsibility as a clinician. So why self-care is essential? Like we talked about this morning, one of the biggest consequences for burnout is professional impairment. And so self-care prevents burnout. It can protect you. It can protect your clients. It promotes safety. It promotes health. It promotes authenticity. But the main thing here to remember is that self-care helps you create quality work. And, most days that's what we're trying to do is just do the best that we can with what we have. And we will have a little bit more when we're caring for ourselves. And then self-care promotes ethical, professional behavior. One of the scariest consequences of burnout is a lack of safety. If you're not able to be mindful at work or provide the appropriate therapeutic space because you yourself are too fatigued or tired, that can not only be dangerous to you, but it can be dangerous to your clients. And there can sometimes be this point of crossing over ethical lines when you're not able to provide the appropriate safety for your clients. And then self-care is essential because your work is more authentic when you practice what you preach. And, you might even have the experience of, have you ever gone to like a doctor or like a healthcare professional, and, they're giving you health advice, but you can see that they're tired too, and maybe they're impatient with you, and it just doesn't feel good to be on that end. And that authenticity, it can be sensed by our client, whether it's conscious or unconscious, but it's there, and authenticity is important. Now, this doesn't mean we have to be perfect clinicians and super healthy all the time, but it does mean we do need to pay attention to our self-care. And then, lastly, is self-care helps you enjoy life as you give to the world. And let's not underestimate this too, because we're not here just to be working all the time or just to help other people, but we're living, breathing creatures right now, and you have whatever time you have left here on this planet, and don't we want to try our best to enjoy that? And self-care will help support your own experience of happiness and joy and presence in your own life. And so I have 8 considerations for self-care. This will also help us put self-care into perspective. So our first one here is you do not need to earn self-care. Sometimes we're on this permission-based system where we feel like we need to earn self-care with hard work. It doesn't necessarily work that way. And from the moment you were born, you were given the gift of self-care. It's not something that you have to work for or that somebody has to give to you, but self-care is an inherent right within you, that you're a human being worthy of kindness and compassion. That means kindness and compassion from others, but also from yourself. And then number 2, self-care is a choice to do what's best for you. Now with this one, this might also mean that self-care can sometimes be the harder thing to do. So for example, a choice that could be hard is saying no to something. When you know that saying no would actually be the best for you, but it's hard to do, and you kind of have to push yourself past these uncomfortable feelings, maybe hurt somebody else's feelings in the process, but that can be self-care. Sometimes it's easier just to automatically say yes to something, but in some ways that can be neglecting yourself. So self-care is a choice to do what's best for you. And again, on the panel, I mentioned the word pseudo-self-care. So pseudo-self-care are those practices that we do that we think is kind of we think it's self-care, but it really isn't. It's an act of either avoidance or numbing, after a super hard day at work, just coming home and zoning out in front of the TV, and then you end up binge watching Netflix and staying up super late when the better thing might have been to go to sleep early and get some rest. And then you might say, well, I'm doing my self-care, giving myself some Netflix time, when it wasn't actually a conscious choice to do what's best for you. But self-care is a choice. Number 3 is self-care is more than just leisure and luxury. So like I was saying, self-care is not just what you do on your free time. It's not just taking a vacation, but it can be doing the harder things, like saying no, setting boundaries. I'll be talking about that in a little while, but self-care is not always easy. Self-care is not always comfortable. It doesn't always feel good. It's not always relaxation. Sometimes we think what caring for ourselves means relaxation somehow. Sometimes it means pushing yourself. Sometimes it means crying when you have to cry, or letting out your emotions, or facing something you needed to face, or having that hard conversation. That can be self-care too. And number 4 is self-care and hard work can coexist. Like I said, it's part of our professional roles. Self-care and work are not separate. We can practice self-care at work with things like advocating for ourselves, making sure you take a break, making sure you're not working without getting paid, things like that. But self-care and work need to go hand in hand. They're not separate things. Number 5 is that self-care does not have to take a lot of time. The number one excuse I hear for not practicing self-care is because we're so busy, and most of us are really busy. There's just not enough time for self-care. Now, some self-care practices don't even take time at all. For example, speaking nicely to yourself in your head. We're going to have this internal dialogue anyway. If we can shift it to a, more kinder voice within our minds, that doesn't take a lot of extra time. It's not like you have to go spend an hour doing something. It's just a shift in something that you're already doing. And then number 6 is self-care is not just about you. So again, like I was saying, self-care does influence the quality of your client care. And self-care influences your loved ones too. Self-care can, make an impact on how well you connect with your loved ones, how present you might be with them. Self-care can include your loved ones too. And so self-care is not just about you. And right now, there's probably a really good chance that there's someone out there who needs you to take care of yourself. So just something to think about. And then number 7 is self-care is a skill that you can develop. And so if self-care doesn't maybe seem natural for you, that's okay. So like music, self-care is something that you can learn how to do. And there are different, realms of self-care. A very common challenge with self-care is the ability to say no. That's a skill that can be built too. Being compassionate or being kind with yourself, that's another skill you can build. So self-care is very learnable, and it's a skill you can develop. And then number 8 is aim for progress. So like I was saying before, with self-care, we're not aiming for perfection, or we're not trying to get to this end point where our self-care is all perfect and, there's this perfect balance in our lives and we're just going to be really happy forever. Life doesn't work that way. Life is going to keep changing for us. And so aiming for progress means that we're aiming for growth and for learning. And it means continually just checking in with yourself to see, what is it I need to learn right now when it comes to self-care? Because usually there's always something new. So again, there's no real end point we're getting to with self-care. It's the process we want to be involved in. So with these 8 considerations, think about which one of these feels just most important or significant to you right now. And this is going to be your self-care anchor number 7. So you can write this down. Which one of these considerations is most important to you right now? This is number 7, and I'll bring back up these considerations. So take a moment to just write that down. Which one of these feels most significant to you right now? All right, so I'm going to take some time here to go over 8 essential self-care practices for burnout prevention for music therapists. Now, something to keep in mind as I go through these 8, you're not expected to maintain all of these 8 things all of the time. That's not why I'm sharing this. This is not a test or anything, so be careful of that inner critic voice. It's really easy to get some information of self-care and then focus on what you're not doing. But you do not have to be maintaining all of these 8 all the time. These are not in any order of importance. And of course, when it comes to self-care, there are definitely more than 8 that are essential, but these are the ones I chose to focus on for today. In my ebook, Resilience Over Burnout, I go over 22 practices that are in there. So you can read my ebook if you're interested in learning more about this, but let's focus on 8 practices for right now. And number 1 is knowing yourself as a music therapist. And there are so many different ways to be a music therapist. There are so many different populations to work with. There are many different theoretical orientations in which to practice from. There are music therapists who are in private practice and business owners, or some who are employed. And other ways of being music therapists are being teachers, being mentors, being supervisors, and being a music therapist comes with so many different roles, and you might have multiple roles or just one, but being a music therapist will mean something different to each one of us. And it's important to know, what is your role at work? Looking at, what is your definition of music therapy even? When someone asks you what music therapy is, what do you tell them? It's good to know what your theoretical orientations are that you're practicing from. knowing your strengths and weaknesses, also knowing your own goals and knowing your client's goals too, also knowing your work limits at this point in your life, and of course, knowing the difference that you make as a music therapist is a huge part of knowing who you are as a professional. And then part of knowing yourself as a music therapist is also knowing what you need. And this means advocating for yourself. Now, advocating for yourself is different than advocating for the music therapy profession. So we might do advocacy work for the profession, but we also need to advocate, for ourselves too. And that might mean, things like either asking for a raise, asking for a change in schedule, asking for, whatever need you might have at any given point in your life. But self-advocacy here is very important, but that does involve knowing yourself and knowing what you need at any given point in your life. Then speaking of your own needs, number 2 is using your support system. And so I find it pretty common that most music therapists do have a support system, but it's a matter of using your support system. It's like you know your friends are there, or like you have professional connections, but we don't often use them enough when we need to. So using your support system, now this can mean a lot of different things. Clinical supervision, I highly recommend as a self-care practice. Personal therapy is another really good one to get to know your needs and have your needs met, and getting to know yourself as a music therapist. One of the gifts that burnout brought me early in my career was a push for me to find my own personal therapy, and that's something I've continued since 2006. And I recommend finding a therapist before a crisis happens, because it takes time to develop a relationship with a therapist. It takes time to find one. And as far as finding a therapist or a clinical supervisor, I recommend, first going by referral, just asking around to see, who might be a good fit for you, or, reaching out to your professional connections to see if anyone has, someone in mind for you. But supervision and therapy, what that also does, it puts you in a client role. So you're not the therapist, you're the client. Now that can be helpful in your clinical work because it's a good reminder of what it's like to feel like the client, but it rebalances that energy out too. When, if you're the therapist all the time and you're the one always listening, we need to rebalance that where, you do have a time where someone's there to listen to you and give you professional support. This is different than, either just talking to your spouse or talking to a friend, where, that whole hour can be about you. And mentors can come into the picture here, and of course peer support. There's also peer supervision, but also, just having regular dialogues with your peers too, and being able to support each other and, have a conversation about burnout, or, if you've had a hard day, being able to call someone up. But again, it's just using your support system. It's, one thing to have a support system, but we need to make sure that you are using your support system. Number 3 is compassion. And so earlier this morning, I talked about how empathy is a risk factor for burnout because empathy can cause fatigue. And so one way to counteract the fatigue that's caused by empathy is with compassion. And so empathy and compassion are 2 different things. Empathy is connecting with what someone is feeling. You might do this by reflecting about what they're feeling through words or through music. It's being with someone in their emotional experience. Compassion is a sense of warmth and caring for the other person or for yourself. And so empathy and compassion can happen simultaneously at the same time. And compassion, it can be conveyed through words, but compassion can be conveyed also through your presence, through the space that you set up, but your ability to communicate acceptance for another person is a very powerful thing. And, if you're sitting in a moment with a client where they're just having a really hard time and they're in their emotional experience and, you are being empathic towards them and maybe reflecting their feelings, you can simultaneously be compassionate with them by believing in them and sitting with them and in the back of your mind kind of saying, saying, I have warmth and compassion for this person. And you can hold them in that sense. And it's believing in their strength to sit with their feelings, to be able to help them and guide them as they're working through their difficulties, but knowing that it's not necessarily your problem to solve, even though it is your role to be there with them. Compassion means setting a certain amount of boundaries so that you're not there to rescue anybody, or you're not there to take responsibility for anyone else's feelings either. But it's just a sense of warmth and caring that can be there. And of course, this can be a sense of warmth and caring for yourself. So if you're sitting with a client, again, who's having a difficult time, you can also kind of tune into yourself and say, okay, I care for myself in this moment too, and not forgetting that you were a part of that. All right, so number 4, we have our big B word, and that's boundaries. So setting and maintaining boundaries. Now, when it comes to boundaries, we can maintain boundaries with ourselves, and we can maintain boundaries with other people. So first, maintaining boundaries with yourself. Here are some examples. Accepting that you don't know all of the answers all the time. Setting a boundary to give yourself permission to be imperfect. You can also set a boundary with yourself to be clear with yourself that it's not your job to save anyone or go out there and save the world. You can also set a boundary with yourself by regulating the number of client contact hours per week to something that's manageable for you. Also, a boundary with yourself is allowing yourself to take a sick day when you need it without guilt. You ever took the sick day and the whole day you're just feeling guilty and, it's kind of like muddling in your mind. But, really allowing yourself that sick day, that's a boundary that you can have with yourself, saying that it's okay. And another boundary is, keeping work tasks separate from personal or family time. So, like Letitia was saying earlier, finishing up your work before you get home in whatever way that might look like for you. So there's some examples of setting boundaries with yourself. Now, setting boundaries with others, here's a list of different types of boundaries that we can have. So, physical boundaries. Now, this is the physical space that you need to feel respected as a person. So we all have different ways of, the way we're comfortable greeting people. You might be a handshaker or a hugger, or maybe you need a fist pound or whatever, you might be comfortable with. That's a physical boundary. Also, it's your distance when communicating with somebody. And, the amount of physical contact or touch that you're comfortable with. These are physical boundaries to maintain. This can be communicated verbally or just through your own action, too. Then we have time boundaries. Time boundaries means protecting your time and not letting other people sabotage or take control of your time. This also means staying on schedule as appropriate and not going over your planned session time. Violations of time boundaries can look like, dealing with people who are consistently late, working overtime without pay, or, again, going over the allotted session time. These are examples of violations of time boundaries. And, time is one of the most precious resources that we have. We do need to be very careful of honoring the sacredness of our time boundaries. And then we have boundaries within your scope of practice. So, knowing what your professional limitations are and just staying within your capabilities and within your own responsibilities. Energetic boundaries are another important one. So, working with what you're capable of doing on any given day and being careful not to run on empty or go beyond empty. So energetic boundaries, This involves just fairly allocating your energy and protecting yourself, especially around people who drain your energy. And now, energetic boundaries, this is a pretty big topic. We could talk all day on how to protect yourself energetically, but one way to do this is with the grounding exercise that we started with. Grounding yourself is a way to first be present with yourself. It's a way to gauge your energetic levels, but it's also a way for you to honor your own energy and feed your own energy when you need to. Next, we have emotional boundaries. And emotional boundaries it just means being able to distinguish your own feelings and emotions from someone else's and not taking on their feelings as your own, and also, not putting your own on other people. But emotional boundaries can also mean honoring your own emotional experiences and just working within your own emotional capacity on any given day, too. And then we have privacy boundaries. This means maintaining confidentiality and then, choosing how much of your personal information to share with clients or coworkers or really anybody else. That is up to you. This also includes, how much of your music you want to share. That is part of your own personal privacy. And then speaking of music, we have music boundaries. So music boundaries, these are the limitations that you place on who has access to your musical instruments, which instruments are reserved for you for work or for your personal use, how these instruments are used. Our musical instruments, do need care and respect. They need their own type of self-care too, and we're responsible for that. So that can be included in music boundaries. And this can also include how much of your own personal music you're willing to share. And, making sure that your own relationship with music remains respected. And when it comes to music boundaries, again, there aren't like these clear-cut lines, or I can say like, this is a boundary and this isn't. This is a very individual experience for each one of us. And, when it comes to boundaries in general, sometimes we learn about what our boundaries are because it got crossed somehow. And that will happen, and that's okay. It's there to give you information on what to do next time. So when it comes to boundaries, know that this is usually a work in progress. And so, if your boundaries get crossed, it's not a reason to be hard on yourself, but it's a way to just collect some information and say, okay, this is an information of what my boundaries need to be right now at this point in time. All right, deep breath in. Exhale. Any questions specifically on boundaries before we move on? Yeah.
One little thought about the question that was asked before about the boundary of not taking things home.
Yeah.
I know that it's really easy to want to talk about the patients that we work with, either for the good or for the hard moments. And
Yeah.
I know you can do that with absolutely maintaining privacy by de-identifying, but there's something about trying to have that boundary of not bringing those stories home just for your own personal. So I don't even know which boundary
Yeah.
it would really be about.
Yeah, so the question is, sort of bringing these work conversation into your home.
Like the story.
Yeah, so the stories. And so that's a really interesting one, and it doesn't necessarily fit in here, and because it is going to be different, I think, on any given day for you. So there will be times where maybe you just need to turn it off and not talk about it, save the conversation for the next day at work. But there are those other times too, and this can be in positive or negative situations. Like, what if you had a really good day at work, and you want to share that, and that thing would be great. And of course, not identifying who your clients are or whatever, like those obvious ethical boundaries, but that can be a great thing to bring back. But also, if you did have a hard day at work and you come home and it's very obvious to your spouse or your family that you're just off-centered because of something, sometimes it can help to share a little bit of what happened. Say, I'm just like this right now because something happened at work. And then it's up to you how much of that you want to share. And sometimes, I've had the experience of just hearing, I work in trauma. like hearing like a horrible trauma story one day and coming home, and it's just kind of weighing on my heart. And, maybe just sharing a piece of that story with someone so we can share the experience together. So it's not something that I feel like I'm carrying all by myself. If, I don't have, if I'm not like meeting with my clinical supervisor right away to process that experience. But I think that can change on a daily basis. And that is a tricky one, though, of, establishing these lines between work and home, because it is fluid and it's not something that has this very clear delineation. But that is a good question. And, it's something that is worth exploring for yourself, because I think it's going to be different for all of us, too. Yeah. Does that answer your question? Oh, thanks. Yeah.
Just on top of that, I think you set boundaries at home, too.
Yes, setting boundaries at home. Yeah.
My husband and I have a thing that when
Yeah.
we both get home, the cue for us is, I've got a work story.
Yeah.
And that gives us each permission to share something if we want to. And then we're done with it. That we
Yeah.
sort of put it away, but it's right at the beginning when we're both home, and then done for the evening. So those boundaries, and we came to those in agreement.
Yes, so you can have boundaries at home, and yes, coming to an agreement with the people that you work with. And I like what you're saying, because you literally say, I have a work story. Now, that word story is really powerful because it puts a container around something. It's not like you coming in with home with all these emotions and like dumping it on somebody, but it's like, okay, there's a story here, and it's influencing your present experience. But yes, setting boundaries at home. Yeah, thanks for sharing that. All right, let's move on to caring for your body. So physical self-care. Now, this is a very big topic. Again, I could talk all day about this, but what I want to emphasize is caring for your body does not just mean diet or exercise. So, as music therapists, this means, for one thing, caring for your voice. And I've worked with so many music therapists who are, having vocal issues. And caring for your voice means respecting your voice. And, if we want to be music therapists long term, we need our voice to work. And so, sometimes it can mean revisiting vocal lessons of, learning how to sing again. That sometimes is needed, and it's okay if that's needed. Sometimes I do encourage people to get amplification if it's possible. Like a microphone is so helpful. Like if I didn't have this and I had to talk to you all with a very loud voice all day, that would be extremely tiring and not good for my voice. But again, we want to go for having a long-term relationship with our voice and with music. And when we think of our voice, it represents something bigger too. Your voice is who you are. And one more suggestion I have for caring for your voice is making sure you're hydrated. I recommend carrying water around with you. Don't wait for a water break. Don't wait to get back to your office or to your car. Like there's little water bottles you can carry around in your guitar case, but have water with you. If you get thirsty, it means you're already dehydrated. So just keep hydrating, and that's a great way to care for your voice. Now, your body as a whole, your body is an instrument. And when we're playing music, we need our bodies to work. And music therapy is a very physical job. And, sometimes it's easy to forget that. And, I do like to use this idea of like, what if we treated our bodies the way athletes do? Like with athletes, their job is their body too. But same thing with us, that we need our bodies in a similar way, and we need to respect our bodies in a similar way. Now, when it does come to diet, exercise, and sleep, which are the big three for your body, I recommend prioritizing sleep as number one, because sleep is absolutely essential for your mental health, and sleep is one of the best ways to help prevent burnout. It's when you're sleeping that your brain can process everything that happened during the day, refresh yourself for the next day, but it's an absolute for our own mental health. All right, and then number 6 is grounding, and we did this today. So grounding is a therapeutic technique, and it's a self-care tool that cultivates presence, centeredness, and self-awareness. So like in our meditation today, it just involves being with yourself. You don't necessarily have to be sitting down to be grounding yourself. You can be standing up. You could even be moving. You could also be playing music. That can be grounding too. There's lots of ways to ground yourself and to build inner strength. And I do recommend just experimenting with different things to see what does feel grounding to you. And this can be a personal experience. So, what feels grounding to one person might be ungrounding to another person. And grounding doesn't have to take up a lot of time. Either our meditation this morning was just 3 minutes long. Grounding can just mean taking a few breaths. But, grounding just sends yourself a signal that I'm here with you. I'm willing to be with you here for just a little while. All right, next we have self-compassion. So we have 3 components here of self-compassion: self-kindness, common humanity, and mindfulness. So the leading researcher on self-compassion is Kristen Neff. She has an excellent book. The title is Self-Compassion, and she goes through these 3 things in a lot more detail than what I'll cover here. But self-kindness just generally means being kind to yourself through words and through actions, and treating yourself the way you would treat a friend. So again, self-kindness, treating yourself the way you would treat a friend. This means using internal dialogues that are kind rather than critical, being able to soothe yourself when you need soothing, and just not being so hard on yourself. Common humanity. This is a really important one for music therapists. It's recognizing that any challenges or mistakes or failures you might experience are part of a shared experience. They're not just your own, and you don't have to go through these challenges on your own. Common humanity just recognizes that you're part of a bigger collective, and that your own problems aren't these unique things that only belong to you that you have to go through by yourself. But when we can connect to a bigger whole, it can feel more supportive. And then mindfulness is a very big topic. We can look at it in self-care as just being aware of your own thoughts and feelings without judgment. So again, just trying to be aware of your thoughts and feelings without judgment. Now, this can look like just, sitting with yourself, allowing thoughts to come up, and just trying not to label them as right or wrong, but finding some sense of acceptance. Like we talked about with compassion, it's that sense of warmth and acceptance. And when we give that to ourselves, we can be a little bit more mindful. So again, self-compassion has these 3 components, and I highly recommend the book Self-Compassion by Kristen Neff. I also recommend having some type of mindfulness practice. Now, during the day today, we've done some meditation, we've done some breathing. Mindfulness can show up in a lot of different ways, but having some type of mindfulness practice that works for you, that's an easy go-to, is a great form of self-care because it doesn't usually cost money or it doesn't have to take a lot of time, and it's always there for you. It's just a matter of remembering to do it. All right, and then number 8 is something we've been talking a lot about today, and that's honoring your relationship with music. So again, here's the term clinification. Clinification, it's the consequence of a creative arts therapist neglecting his or her own creative process. For music therapists, it looks like, music being something you only do at work, music being something that maybe you once loved but don't pay much attention to anymore, or just feeling a disconnection in your relationship with music. And that can be a very big consequence of burnout because, part of why a lot of us chose us to be music therapists is because of our love for music. And now when that love starts to get lost, that can be a very significant grief experience. A loss of love of any kind can be so hard. But when we lose our love for music, that can be a scary and confusing experience, and it can be experienced as grief. Now, this is something to keep in mind. Like I said, our relationship with music, it's not just gonna be like super great all the time. Like, it's a relationship. Relationships have their ups and their downs, and they're here to teach us things. But honoring our relationship with music means paying attention to it. And, even if, there's a time where you do feel disconnected to music, honoring your relationship with music might mean honoring that disconnection. Maybe it needs a little bit of space for a certain amount of time, just being careful of how long that lasts, and then seeing how, maybe you can get it back on track in a different way. And, one of the hardest things about being a music therapist is losing that innocence in the love that we have with music that we had before, where, music was this purely like just joyful, fun thing at some point in our lives. Then it started to become something that we studied, and then it changes, and then it becomes our work, and then it changes, but it will go through an evolution. And, we do need to let this evolution happen, but we can let that happen without losing the love for it. But again, like anything else in life that we love, love means that there's a risk for pain or for hurt or for, miscommunication, and that'll happen with music. And that's part of why we're doing these exercises today, to communicate with music. As far as honoring your relationships, some recommendations I do have are, participating in music activities outside of work. Whatever that might look like for you. It might look like, performing music on your own. It might look like going to a concert. It might look like, going to a sound bath or something. But I do recommend getting in some type of place where you get to be the music listener and someone's there to be playing for you. You don't have to be the one playing music all the time. And, when a disconnection with music is felt, again, honoring that it's there, just recognizing the disconnection. We don't have to label it as right or wrong. We also don't need to freak out about it either, but it's that mindful knowing that it's there, maybe not placing a bunch of judgment on it, but then being able to work with that. All right, so our 8 practices here are listed, and your next self-care anchor is, which one of these 8 self-care practices do you need to focus on right now? So again, which ones do you need to focus on right now? And here's the 8 that are listed. So take some time to identify this for yourself. This is your self-care anchor number 8. All right, so let's keep working on number 8 right now. So this morning, you wrote a letter to music, and then you read it out loud, and the music ambassador listened to it and heard you. What we're going to do now is we're going to flip that. You can get a clean sheet of paper out. This time what you're going to do is you're going to write a letter to yourself from music. Now, this is going to take a little bit more creativity, because now you are going to embody the voice of music, and you're going to practice speaking to yourself. Now, if you want to, you can start your letter off like this, like, "It's me, music. Here are some things I want you to know." Or you can start it off some other way if you want to, whatever works for you. But before we start this, just take a breath in, gently exhale. Take a moment to just connect to that idea of music. what music is, what its voice might want to say to you. And then when you're ready, you can start writing your letter. And so again, we won't take a lot of time with this. We'll take maybe like 5 to 7 minutes because we want to just get the main points out here right now. This is something you can maybe journal on later if you need to go more into depth. But see what music has to say to you right now. All right, so just take about another minute or so. All right, so start to wrap up your letter. Again, if you need to continue this, music's always there to talk to you or to talk with. Now take a moment just to sit with your letter. Take a deep breath in. Gently exhale. Place one hand over your letter and just take a moment here to honor this as sacred communication. Another deep breath in. Exhale. I'm going to have everyone stand up. All right, so what we're going to do, we're going to partner up sort of like last time. This time what you're going to do when you partner up, you're going to switch letters. And your partner is going to read your letter back to you. Remember, your partner is the ambassador of music. So it's a music voice speaking to you. So find a partner. You can decide who wants to go first and then switch. If you need a partner, raise your hand. Oh, there's 2 people here. If you don't have a partner, I'll be your partner too. You can also be in a group of 3. This works as a trio. Can we turn on the mic for number 6?
You can go ahead.
Okay, thanks. Raise your hand if you need more time. All right, everyone have a seat. So which letter was easier to write? To music or to yourself? Which was easier? They're both hard. Anyone care to share what your experience was like writing this letter? What was the process like? Yes. Oh. Oh, hold on. I'm going to give you a microphone.
I had a really my first reaction after 15 years was like, listen. So I took a breath and had a lovely experience. So it was very nice. I like the dichotomy of the first letter to this one too. So thank you.
Well, the second one was easier for me, mostly once you crack it open. I mean, it's there. So I kind of knew what music was going to say after what I already said to music, so it was like really kind of easy. That was it.
I had trouble writing the second one more than the first one, and I think coming from like a student perspective at Berkeley, I kind of was like thinking about what music would think about me. Like it's kind of weird, but like, hi David. Like coming here, we were just discussing how your relationship kind of changes with music as a student, especially when you go to study it, and how I was reflecting back on when I would just like sit at the piano as like a 7-year-old and just like bang away at the keys, and how music was there for me then, and now in school, I don't have time to just sit around and bang on the keys. I'm like studying my theory homework and whatever, and in my letter from music, I kind of wrote about how music has supported me, but sometimes if I were in music's shoes, I don't know. It was very reflective, and I love this activity. Yeah, it got me thinking. Oh yes, go ahead.
I actually had a very interesting experience writing both of the letters because in the first letter, I apologized to music because I took some time away and I have like these guilty feelings about that. So then in my letter to me, I was like, I forgive you, like music forgives me, if that makes any sense. So I feel like I just had this very therapeutic experience of music forgiving me for that. So yeah, it was really cool. Thank you.
Well, I think the difference between the first and the second, for me, I think was just a recognition in that in the first exercise, it's very personal because it's our individual relationship with music. But I think that we all feel music is kind of bigger than us. So when we look at the second part, we're looking at something much greater that has the capacity to forgive and that has the capacity to respond and all that sort of thing. So it's kind of, I think that it's a completely different perspective, to look at how we feel, and it's a little bit more self-reflective than the first time. And I think the second exercise is really just looking at some kind of greater capacity within music, which is really just out there in the world anyway, to kind of give us that forgiveness and that acceptance that we need.
Yeah, well said. It's like number 5.
And you need to really talk in the mic.
The second one was definitely harder for me to write. The first one, I felt like I could write for hours, because it's easy. It's easy to think about and talk about and verbalize like how much I love music and the way that I feel about music. It was harder for me to get out the ways in which music loves me back. But it was so validating to go through that. This was a really powerful exercise, and I really appreciated it. Yeah.
Thanks for sharing.
Hi, so I'm in my first semester and I came from class, so I just did this one first. But yeah, I feel like this was a really, really good exercise, and to also be able to externalize the fact that music is there for you, and it's not like something that to feel pressure that if you didn't take the time to, for me personally as a student, like I've been away from music during holidays, and then when I came back in Berkeley, getting it back into it, there's no way to reproach yourself when it comes to understanding that actually music is there for you, and it's a really a therapeutic way to be with and to write in terms of the music to talk to me. I feel like, yeah, actually it's there's no point in being harsh on yourself. And actually, when I pen down my thoughts in the music perspective, it's more of like, how to say, it's just a reminder that the music is always there and it's always forgiving. And that's why, I mean, I don't know much about this career, this profession, not just yet, but I know that when it comes to treating patients and everything, it's always about that being aware and forgiving to the patients to you. It's a relationship, and it's a beautiful one. I don't know. Yeah, thank you.
I was thinking almost very similarly to what you said, except there's a big difference in our ages. So it's kind of an interesting thing. You probably noticed that. And so it's an interesting observation because I found the second one easier. The first one, it was sort of like me talking to an old friend that I haven't seen for a while. It's like, oh, what do I say to you? And the second one, music talking to me was like, the first one was my saying something. The second one was, in a sense, an old friend giving back. So music is giving back to me. The first one was sort of my feeling a little awkward and approaching someone I haven't seen for a long time in a way. And the music speaking back was my receiving from a beautiful old friend who knew just what to say. And that's kind of what I was sensing from what you said just then, which I thought was really beautiful. Thanks.
Yeah, I think I'm going to echo what a lot of people said in terms of how it felt at the beginning. For me, it was something that I think feelings that I needed to let out of like guilt. I said, music, I'm sorry, we broke up. And so, but the second one, she forgave me and said, I've been there, you just didn't know I was there. So we made up. And I think the third piece I was also thinking is just so interesting how as music therapists, we have these intense feelings of guilt when, we can have, not all the time, but for other professions, I'm thinking, for social workers, do they feel the same way of, I'm going to forgive you counseling, or I don't know, just comparing it, like this is the intensity that we feel towards our work. So I want to thank you for giving us this opportunity to explore those feelings. Thank you.
Hi. So yeah, even I felt like the second one was actually a lot more easier because like I felt when I was writing the second one, I felt like music was actually giving me hope. It gives me like I shouldn't quit, or music will always be there for me. But when I wrote the first one, it actually took me a lot of time, and it felt like as if I was venting out. But with the second one, I felt a lot more hopeful. So yeah, thank you so much. This is a really good exercise.
You're welcome. You're welcome. And so part of this letter writing exercise I'm trying to do here is, when it comes to our relationship with music, it's important to remember that it can exist outside of playing music. Sometimes we measure our relationship with music by how much time we're playing music, or it feels when we're playing a guitar or whatever, but we can remember we can communicate with music in different ways. And this is just one way, but that we can dialogue with music too, whether it's through pen and paper, whether it's, in your own head. And, if that disconnect with music ever comes, you can bring it up with music and discuss it. It doesn't have to be something you're holding all by yourself and thinking, oh no, but bring it up with music. Remember, this is a relationship. It goes both ways. And, as a music therapist, I keep using this term, you're an ambassador of music, because you are. This also means that you are very much in touch with the voice of the entity of what music is. And it's very likely that you speak this entity's voice when you're with your clients. You bring the message of whatever music has. But the message is there for you too. We just need to open up those channels. And, this is just one way to do it. I encourage you to modify this exercise as you need it. You can change how you can communicate with music. And, sometimes this conversation can happen with music too, maybe an improvisation. Or, you can find a peer to play music with, and, maybe it becomes a bigger conversation. But get creative with these exercises and how you communicate with music and how you start to perceive your relationship with music and how you evaluate it from time to time. And, it's easy to sometimes get caught up in those feelings of just not enough, or I'm not doing enough. But again, those are some signals to bring in compassion. And most of the time, music does have a kind, compassionate, and, forgiving voice. And tap into that when you need to. So, we're going to take a break. Next, we have our panel discussion, Moving the Music Therapy Profession Forward with Strength and Resilience. That will be at 3 o'clock. Right? Oh, 2:40.
2:45.
2:45.
Correct. Hold on. 3 o'clock. Yeah, I don't know why I kind of messed up the schedule apparently, and no one pointed it out to me.
Maybe we can do questions for 15 minutes.
So what we can do is we'll come back at 2:45.
Yeah.
Because of the weather, and then we can take a little bit more time for questions, or if people need to we can actually end at like 4:30ish, if you want to beat the Boston rush hour traffic. But yeah, I don't know why I did a full half-hour break. But we're going to come back at 2:45. Is that cool with everyone? Yay! Right. I am going to ask our next panelists to briefly come up here, if you don't mind. So that would be Kristen, Mary Carla, Lisa, Eve, and Moran.